Hello, Alexandros.
Hello.
And thank you for coming to the interview.
Thank you so much.
So we are at the evidence-based management of acute and chronic pain course by Dr. Martin Hugh, and it were a great 3 days until now. We can't wait for the next seminars. So firstly, before putting the question, I will introduce you to the community in Romania. Alexandros Sideris, he is senior physio at Physioscience Clinic and Pain Physios. He's a guest lecturer at University of West Attica and an educator at Hellenico MT-Edu and OMTRO in Romania. So, how has pain science changed the way you treat and examine patients, Alexandros?
Well, this is a question that cannot very easily be answered with very few words. I would just say that at around 2008, 2009, when pain science opened the door for me, and I realized then how different my approach would be to patients if I would educate myself in the mechanisms and the ways pain is being built up in the human body. So since then, as people say many times, it's a journey for me. I learn every time. I teach pain in the last 10, 12 years in all these courses. And I believe a physiotherapist should have this capability of being able to assess a patient's pain as something that you cannot do without.
Okay, you are the first person that introduced pain science to me, so I can confirm that it's a great way and it's a great thing to learn in order for you to treat your patients better, let's say. Okay, so the next question would be, what do clinicians misunderstand about chronic pain? What do you think?
Well, the most common misunderstanding would be clinicians, doctors as well as physiotherapists, consider chronic pain as a problem that has to do with structural misdiagnosis. So if you have pain for a long period of time, something is wrong with the tissues and you need to fix it. We know in the last 20, 25 years, this is not the case. The longer period you are in pain, the less possibility there is a structure in your body has a problem. Usually, it's functionality that has a problem. Usually, it's the system that has made arrangements to consider painful things that should not be.
Okay, so if I may summarize, we should go from the biomedical way of thinking more to the ICF or biopsychosocial way of, let's say, understanding patients.
That is true. I would say we should add psychosocial as well as high-quality neurobiological findings to the whole biomedical idea. Biomedical consideration of the human body and the human health does not mean just see the structures.
Okay.
It means consider and learn about the functions.
Okay, thank you for your answer. How much should we care about imaging, let's say? When is imaging relevant or not?
Well, in the musculoskeletal disorders, that's not my saying. It is so well known, documented, and we know now it's true. Imaging should not, in general, pose the diagnosis. Imaging is to rule out serious pathologies. So imaging is there to tell the clinician the patient does not have something really serious. A fracture, a disease, cancer, stuff like that.
Okay.
And 95% of the times, the case is not something serious. So if we rely only on imaging, then the route, the way of wellness goes completely wrong.
I understand. So it's not all we should care about for sure, but it's an important tool to rule out serious pathology.
Exactly.
Okay, are orthopedic tests still relevant for physiotherapy? And if yes, why and when should we test?
Clinical tests, orthopedic tests as we learn them, are a valuable tool. In the past years, in the last decade, we realized they are not as specific as we thought. So again, one test is not very good in putting a diagnosis. But a cluster of tests, so a battery of tests, an amount of tests, added to the total clinical examination and be part of the clinical reasoning process are a valuable tool. We have to test to realize as persons what's happening with the patient. We do not put the diagnosis through just one test.
Does manual therapy still play an important role in treating patients? And please explain how.
Yes, it does. Although manual therapy has got some really, how can I say, so it has many defeats in the last 15 years in research about its potential efficacy. Today we know it works in many circumstances as a valuable tool of changing the symptoms. Changing the symptoms is the window of opportunity, as manual therapy masters say, in order to do effective treatment, which is most of the times loading and exercise, in order to change the patient's condition and bring him back to normality and health.
Thank you. So, if you had 60 seconds to send the Romanian physios community a message, what would that message be?
Well, I'm so happy to continue to be in Romania. I'm teaching there. I think now I have almost 10 years as a teacher there. So what I want to tell to my friends in Romania is continue becoming better, continue to consider education as the most valuable tool to make you better clinicians, and never stop getting better through knowledge.
Okay, thank you, Alexandros, for all your teachings, and let's learn together and treat our patients the best way we can.
The best way we can. Thank you, Eddie.